Planned Parenthood closes 5 clinics in NorCal due to funding cuts under Trump. Imagine losing access to vital healthcare simply because of a political decision. This is now the reality for thousands in Northern California. But here's where things get even more heated. The recent closure of 5 Planned Parenthood clinics isn't just causing a stir, it's igniting fierce debate about the future of reproductive healthcare in America. Just days after former President Donald Trump put his signature on a sweeping spending bill, Planned Parenthood Mar Monte, the nonprofit's biggest affiliate in the region, announced it has been forced to close clinics in South San Francisco, San Mateo, Santa Cruz, Gilroy, and Madera. The reason? A devastating drop in federal funding since the passage of the One Big Beautiful Bill on July 4th. For many, the move feels less like a budgetary adjustment and more like a backdoor ban on abortion rights, especially in states that have long protected reproductive choice. In an emotional statement issued online, Planned Parenthood Mar Monte explained that the new law stops Medicaid reimbursements to organizations who both provide abortion services and receive more than $800,000 from Medicaid annually, criteria that precisely match their operations. Up until now, although federal dollars have been blocked from covering abortions since 1977, clinics could still be compensated for services like STI screening and regular health exams for Medicaid patients. With roughly 80% of their clientele depending on Medicaid and federal reimbursements accounting for half their yearly income, about $100 million, the impact of this funding cut cannot be overstated. Here's the part most people miss. These 5 shuttered locations served over 22,000 patients last year, the majority from low-income backgrounds who relied on these clinics as their primary healthcare source. What happens now to these individuals? Is it fair to expect alternative clinics, often already stretched thin, to pick up the slack? Local lawmakers haven't held back. Representative Kevin Mullen, who represents the San Mateo area where 2 clinics are closing, called it out as the result of shameful extremism by the Republican-led House. For years, Planned Parenthood has been more than a political symbol. It's been a lifeline for countless Bay Area families, providing everything from cancer checks and birth control to general health checkups. Assemblymember Diane Popan underscored the stakes. Without these clinics, women could miss cancer screenings and prenatal care, and youth could lose access to contraception. Is the country ready for the public health fallout? But the controversy doesn't end there. Spokesperson Andrew Adams shared that Mar Monte tried to minimize disruption by focusing closures where other clinics still operate, and reaching out to patients to reschedule at nearby centers. Still, some programs, including prenatal and behavioral health care, will be cut from several sites. Can real continuity of care be maintained, or will patients inevitably slip through the cracks? And here's another controversial twist. Mar Monte says it lost $1.7 million in a single week simply by keeping the clinics open. They're bracing for a $5 million shortfall by month's end. Adams didn't mince words. That business model is not sustainable. We can't keep doing that. To survive, the organization is now looking to the state's Medicaid program and private donors, and weighing new offerings that could generate direct revenue. Legal battles are already underway. The Planned Parenthood Federation of America has sued the Trump administration, but a Massachusetts judge allowed the federal government to withhold reimbursements for now, with the case possibly heading to a Supreme Court that's historically hostile to abortion providers. Some argue the deck is stacked. So, what do you think? Are these closures a necessary, if painful, outcome of fiscal policy? Or are they a deliberate assault on healthcare access for the most vulnerable? Should states and donors get expected to fill the funding gaps, or is federal support essential to guarantee public health? Drop your opinions in the comments and let's get the conversation started. Because this is a debate that's far from over.